Hello, my name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. It's such a privilege to be able to present to you the December 2022 issue. There's a lot of content, so I'm going to speed through it. First, we have 4 articles that are my choices, 2 on trajectory and time course, 1 in sepsis looking at biomarkers and clinical phenotype, the Phenom study with first author Horvat. The second article looks at vasoactive dependent shock by Parizes et al. Then the second 2 articles are on risk stratification, sepsis and acute brain dysfunction by Alcamo et al. And febrile children in the emergency department by Lenihan et al., looking at blood and clinical markers. Then in the PCCM connections section, 5 articles. The first 3 are on fluid accumulation, prolonged mechanical ventilation, and ventilation liberation. We will return to these topics, so do have a look at these now. Then in the PCCM trials section, I've got 2 commentaries, one by Alex Rotter, Steve Shine, and Martin Kneiber, who wrote for us last year about high-flow nasal cannula and bronchiolitis, and they essentially said we can't move on until we have RCTs. Ramnarayan and Peters were authors of the first ABC study that was published in JAMA, Step Up and Step Down. So I wrote to them both groups, and said, how do you interpret the data from these trials? And what do you do on your units? What about the implementation? So we've got 2 commentaries. It's like going to a conference, well worth a read. And then last in the PCCM section, connection section, I'm really excited about a mini symposium. I asked 3 groups, Capcorn, Polizzi, and PCCS-SG, to give us an overview of their research groups. Capcorn, who we've already heard about today, are authors of the Phenoms study. I asked them to give us the history. The last update we had from them was in 2006, and Mike Dean gives a really robust and well-rounded overview. The Polizzi study, it's their group, it's their 20th anniversary, and the leadership there have presented us with, again, an overview and their new transition as an organization and into education. And then the UK PCCS-SG have spent 20 years developing a theme of pragmatic clinical trials. What exactly does that mean? And it's well worth looking at that article. And then lastly, we have a narrative, Can You Hold Him? Well worth looking at, and I hope you connect with that. Also for your interest, I have a foreword about PCCM processes and metrics for the journal, a bit about our impact factor. So altogether, I hope you enjoy December 2022, and we'll see you in January 2023. Thank you.